love Invisalign for our patients. There are three main reasons why I really love Invisalign. One being the hygiene is just so much better. You're able to brush and floss normally. When a patient has braces on, it's a lot more difficult to get in there with the floss around the wires and brackets. Brackets also accumulate a lot of plaque and bacteria, whereas with Invisalign, again, you're able to brush and floss normally. You're taking your aligners out like you normally do. Number two, I think the fact that you don't have any food restrictions is great for Invisalign. With braces, unfortunately, you have to be really careful with what you eat. You don't want to break anything. When you break a bracket, the tooth can move and you're set back with treatment. With Invisalign, you can eat whatever you want. So you don't have to worry about breaking anything. Of course, sometimes attachments do come off, but for the most part, you're really not worried about breaking anything with what you eat. So you can eat pretty much everything that you love eating. That's number two. Number three, I love Invisalign because there are no emergency appointments. So with braces, unfortunately, wires can become pokey, brackets can break off. You have to make an extra trip to the orthodontist in order to get that fixed. With Invisalign, you don't have to do anything. There's nothing urgent that could go wrong with Invisalign. So no emergency appointments. You don't have to worry about anything causing a lot of pain. So with braces, again, there are issues with brackets and wires and things like that. With Invisalign, you have aligners. If something's bothering you and you have to take your aligners out, you certainly can. We don't advise that you take your aligners out unless you absolutely have to, but for the most part, there's not a lot of pain associated with Invisalign. It's very gentle movement. So we treat patients as young as 6 with Invisalign and actually as old as 80. So we treat a wide range of ages with Invisalign, and I think because you're able to keep up with the hygiene, you can treat really anybody with Invisalign. So for patients that have periodontal issues, like some of our adult patients that have maybe some issues with their gum tissue or bone around the teeth, we can make sure that teeth are moved in a manner that maintains the health of the teeth throughout treatment. So the only reason why we would switch an patient in Invisalign over to braces is because they're probably not the best keeping up with the 20 to 22 hours of wear with the Invisalign. So usually it's a compliance issue. Very rarely do we have to switch to braces because we're not able to make the movements with Invisalign that we would be able to make with braces. I think that's pretty rare. If we have a patient that is committed to wearing the Invisalign 20 to 22 hours every day, we can treat pretty much every patient, any patient with Invisalign.